Hi, my name is Anthony Crocco, and I'm an emergency doctor at McMaster Children's Hospital. You or your loved one have been diagnosed with a virus infection that may or may not be COVID-19, the new coronavirus. I am here to explain what to expect from this virus, what you can do to feel better, what you should do to keep your loved ones safe, a little bit about masks, and when to be seen again by a doctor. Let's first talk about what to expect. The good news about COVID-19 is that most people, especially children, do not get very sick, do not need to stay in hospital, and don't die. I have a young family myself, and this was one of my biggest worries. Most people, especially children, will be okay. Most children's symptoms will get better in 1 week, and the most common symptoms are fever, runny nose, sore throat, cough, trouble breathing, and sometimes vomiting and diarrhea. The one symptom that we worry most about is trouble breathing, and we'll talk a little bit more about that in a few minutes. It's important to know that even when the symptoms of COVID-19 get better, the infection can still be spread to other people. Now, even though most people fully recover from this infection, some can get very sick. Some people will need to be admitted to the hospital, and some of these might die. Those at the highest risk include the elderly, people with heart or lung problems, people with weak immune systems, or people with other conditions like high blood pressure or diabetes. You may have heard that this virus spreads by droplets. What this means is that this virus doesn't float around in the air waiting for you to breathe it into your body. Some people can get this virus because someone who's already sick coughs or sneezes directly on their face. When people cough or sneeze without covering their mouth and nose, they send a spray of wet droplets onto anything in front of them. Most of these droplets are so small they cannot be seen without a microscope. Most people get this virus by touching something that has these tiny droplets of virus on it and then touching their face. Your face, including your eyes, nose, and mouth, is like the front door to your body, and your hand is what carries the germs to that door. Having clean hands and trying not to touch your face prevents this virus from spreading to you. Now let's talk about what you can do to help keep you and your loved ones healthy. The first thing that we suggest is what's called social distancing. What this means is to try to stay far enough away from people that you won't get sprayed in the face if they cough or sneeze. We usually suggest 6 feet or 2 meters. As well, social distancing means not getting together in large social groups. For those who are sick, we often recommend self-isolation as best as possible. Social distancing really is one of the best ways to prevent the spread of this infection. Another thing you can do is to wash your hands regularly, especially after being out of the house, coughing, blowing your nose, using the toilet, and before making food. Remember, the face is the doorway for this virus. If you haven't washed your hands and you're preparing food for someone, you may accidentally put this virus into their body. To stop spraying this germ, we need to encourage people to cough or sneeze into their elbow or into a tissue, which should then be thrown out. Again, hand washing is important. We should try not to cough into our hands. We need to work hard to prevent these tiny droplets from being sprayed on our hands or the people and objects around us. If the doctor thinks you or your loved one may have the COVID-19 virus, they might do a simple test using a soft stick to learn about the germs in your nose and throat. This is called a swab. Who we swab will change over time as we learn more and more about this virus. Someone from public health will call you in the next few days with the results of this swab. They can tell you what to do to keep yourself and your family safe at home. Please make sure we have the right phone number for you. Let's talk now about what you should do while you get better from this infection. Like other viruses that you've had before, it's important to drink lots of fluids. This helps make sure your body doesn't get dry, something we call dehydrated. You should also get lots of rest. If you're feeling unwell, consider taking over-the-counter medicines like acetaminophen. Ask your doctor or pharmacist for advice about this. Over-the-counter cough medicines are generally not recommended for children. There is one thing that has been studied and found to work, and that's honey. Honey can not only improve children's cough, but also improve their sleep when they're sick, something I'm sure you'll agree is very valuable. The only warning is not to use honey in children less than 1 year old. To stop yourself from spreading this virus to others, there are a few key things you can do, which we've talked a bit about already. The most important thing is social distancing, which means people might be in the same room together, but more than 6 feet away from one another, as well as avoiding getting together in groups to begin with. You might hear the term self-isolation. This means keeping someone who is sick completely away from others who are not as best as possible. This means a sick person may stay in their home but in a room away from others. For families with children, we know this is difficult, but ask you to do your best. If you get told you have COVID-19, you should isolate yourself as best you can until public health tells you that you are no longer considered contagious. Public health is able to answer many questions people have who are at home. Other ways you can prevent this virus from spreading include washing your hands when appropriate and being careful when you cough or sneeze not to spray this virus on the people or things around you. It is really important if you are sick to be careful around people who are at higher risk of becoming seriously ill. As we have talked about, this includes the elderly, anyone with lung or heart problems, anyone whose immune system is not healthy, or people with other health risks. Next, let's talk a little bit about face masks. Because this virus is spread by droplets and is not floating around in the air, masks are usually not very helpful. You may see your healthcare team wearing masks because we often get coughed and sneezed on while we're caring for patients. In the hospital or doctor's office, people who have symptoms of a virus infection are often told to wear a mask to stop them from coughing or sneezing on their healthcare provider. For everyone else, we don't routinely suggest wearing a mask. First, because this virus is spread by droplets. And second, because you need to touch your face in order to put the mask on and take it off. Remember, touching your face is risky. The last important thing I want to talk to you about is when to call or go see a doctor. I want to share with you my top 4 reasons to worry. Number 1, if you or your family member have more trouble breathing. This could mean breathing faster or heavier than usual, feeling out of breath, making it hard to speak, or seeing the lips turn off color, like gray or blue. Number 2, if you or your loved one is not drinking enough fluids and getting dry or dehydrated. Ways to know if this is happening include not peeing as much or not at all, getting a dry mouth, feeling very thirsty, not making tears, or having a fast heartbeat when sitting still. Number 3, if you or your loved one are becoming more tired or not responding normally, becoming harder to wake up, or feeling more lethargic or dizzy. The last reason is if you're worried that you or your loved one's symptoms are getting worse from when the doctor last saw you. If any of these things happen after we send you home, you have several options. You can call telehealth, or you can call your own family doctor. You can go to a COVID assessment center, or a walk-in clinic, or an urgent care center. If you're very worried, you can come to the emergency department, or even call 911. For those coming to the hospital, we are now limiting the number of caregivers or visitors to 1 and asking that if visitors are sick that they stay home. We are working to control the spread of this infection in our hospital. There is so much information online and it's hard to know what to read and who to trust. We suggest using the information from Public Health. Public Health has a number of good resources online, including a tool to help you understand whether you need medical help with COVID-19. As this pandemic evolves, Public Health is your most reliable source for up-to-date information. Thank you for taking the time to watch this video, and remember, we're here for you.